Well, today I'm going to talk about compassion-focused therapy, or CFT. This helps by encouraging people to be more compassionate towards themselves and other people. You should work with a CFT therapist if you are seeking ways to relate to yourself and others with greater compassion. This therapy comprises of social psychology, neuroscience, Buddhist philosophy, cognitive behavioral therapy, and developmental psychology. One of the primary therapeutic techniques that is used in this type of therapy is called compassionate mind training. This helps individuals experience compassion more for self and others. And some of what can be treated with compassionate focused therapy are shame, anger, disordered eating, self-criticism, self-injury, and depression. You know, friends, I want you to remember that this is only an overview. It's not meant to be a substitute for professional advice, medical treatment, medication, diagnoses, or mental health therapy. Always seek the advice of your physician or qualified mental health provider if you have any questions regarding your treatment options. Don't forget to like and share, and be well.